Hello, hello, hello. Good morning, everyone. I'd like to welcome you on behalf of Cross-Counselling Counselling to this event this morning. My name is Aidan Brown. I'm Project Manager for Cross-Counselling Counselling. I have to start by just advising you where the fire escapes are, just in case. We have a very full room this morning, so the door you came in at the back, the door to the side, and there's also one here through this curtain behind the screen, just in case. So it's important to get that out of the way. Could I also ask you just to turn off your mobile phones, or at least put them on something that is non-disturbing. And just for those of you who are into the twittering, that's our hashtag for today. And apparently there are people here who are into twittering, so we'll see what happens as a result of that. So we're delighted to have such a large attendance this morning, and as those of you know who wrestled with the waiting list, it was a bit of a journey, and I was sort of tempted to put on a special counselling session at lunchtime for those people, including myself, but I think we'll put it behind us now, and I'm delighted that we managed. Eventually we had to increase the capacity by 50 to try and get in as much of those people as possible, and we still have left people outside. So it is going to be a little bit crowded, and I apologise for that in advance. If it gets a bit stuffy, we'll open the doors and try and get some air circulating. So why did we have this conference? I suppose for those of you who aren't aware of Cross-Counselling Counselling, this is our 40th birthday for teen counselling, and in the last 3 years, Cross-Counselling Counselling have been evaluating the service that has developed over that period. And so what you will hear today is the results of that evaluation, and you'll see the manual that has been produced to ensure that the work going forward is true to how it has been developed. But as we set about, how are we going to do this, we thought there is no service that stands alone, and that it would be really important that as we talked about our own service, we'd also try and take the opportunity to talk about other services that existed in the continuum of services to young people, and particularly to their families. Cross-Counselling Counselling is built out of a family therapy model, and it works on the basis that young people do not exist in and of themselves, but also as part of their families and communities. So it was important for us that we take the opportunity to give other services a voice to speak and show how we can work together to actually improve the range of services that are available. We also thought, I suppose, that it was important that services that we talked about were services that had been measured or evaluated in some way. And so most of the services that you'll be hearing about today have gone through that process. And then we also thought it would be important to get some input on how do we actually go about that process, and what learning we can get from it. So that's how the programme came together. And I just want to particularly thank the speakers who have so willingly given of their time. As you know, it's not just the time where they come up here and give their presentation. It's actually the weeks before that all the time goes into the preparation that's really critical. And we really do appreciate the help that the group of people who are speaking today have given us, and I know you'll appreciate that. I also particularly want to welcome the Minister for Children, who has graciously joined us today, because, both from her own past history in working with children and families and young people, it's really important that she's here to talk to us about the developments in the service at the moment, and to give us some, I suppose, support at this particularly difficult time in public service delivery. Just to say that housekeeping, CPD points, I know lots of people want CPD points, and that's where we're going. And I was asked earlier, a couple of weeks ago, why did we have such a big turnout? And I'm not actually quite sure why, but I know that that's one of the factors now, is that people need the CPD points for their continued development. So you will be able to access your certificate for CPD points at lunchtime, and maybe before that if we're really efficient. Also, we want to evaluate the conference, and so in your pack there is an evaluation sheet, and we'd ask you to please, before you leave, if you can complete the evaluation sheet and leave it on one of the tables or at the workshops in the afternoon with the cross-care team counselling person who's in the room. We've a very tight schedule, so we wanted to try and fit everything in. It's a Friday. We also wanted to let people go home early. So we probably won't have much time for question and answers, but the speakers will be available to answer your questions, and all of the presentations will be available on the Teen Counselling website from this afternoon. So it's teencounselling.ie. So all the presentations are there, and it also saved us a whole load of photocopying from putting them in the pack. So anyway, you didn't come to read the notes, you came to listen to the speakers. So now, without further ado, I'd like to ask Minister for Children, Frances Fitzgerald, to speak to you.
Good morning, everyone, and thank you indeed for those words of introduction. I'm delighted to be here, and thank you for the invitation to be here at the conference and to hear more about the work that you're doing. It's always a good way to start a Friday when you're asked to cut a birthday cake as a politician, and to hear that more people than are in this room wanted to come to a conference that's about helping young people, a very positive conference, interventions that work for young people and their families. And it is good to focus on the positive, what we know, focus on the research that's been done in Ireland, and hear about the various interventions that are happening. I know people are here from all over the country and from a whole range of organisations and agencies delivering services to young people, and particularly our more vulnerable young people. So for all of those reasons, I am really pleased to be here this morning and to take this time out to congratulate Crosscare Teen Counselling for the work that has been done with the support of Dublin Diocese over 40 years, which I think is a really fantastic record, and well done to everybody who's been involved, who's developed the services as you have done, who's looked at what's effective and come together today to talk about that, to really examine what works when you are dealing with young people. And I suppose, continuing on the positive theme for a moment, I would like to refer back to a report I launched last Friday, which was the ESRI report on 3-year-olds. And that was very interesting, because what it showed was that the vast majority of our 3-year-olds are doing very well in Ireland. But there is a very vulnerable group who, even by the age of 3, are beginning to have very serious issues that they and their families have to deal with. A very vulnerable group, maybe a 15 to 19%, which is significant, group of 3-year-olds who need support, who need interventions, where the socio-economic gradient is beginning to affect them already. That's a real warning to us as an Irish society, I think, about looking after that group of children, because I have no doubt that those 3-year-olds become the 12, 14, 16, 18-year-olds that you were working with as teenagers and young adults. Mary, the clinical lead for Crosscare, said to me earlier, people are terrified about teenagers. Now, I'm sure people in this room are not terrified by teenagers, but actually it is a kind of a common view about our young people, that there's a sort of out-of-controlness, that the drug problems in relation to alcohol and addiction are impossible to deal with. And I think it's really good to get down and focus, as you are today, actually, what are the issues? You can work with the most vulnerable, the most troubled. You can work with families where there are lots of difficulties, and you can make a difference. And that's what you're going to hear about today from the speakers. You're going to hear from Dr. John Shari. I've heard his presentations before on working with families. They are incredibly positive and have terrific results. And I've been delighted that we've been able to give some support to the kind of work that he is doing in some of our parenting programmes around the country. You're going to hear from Nuala Doherty from the Centre for Effective Studies. My department is working very closely with Nuala in trying to ensure that we're doing precisely what you're examining today, that where we put our money, where we put our support, it's going to be on what works. It's going to be on effective services, services that we know when you intervene, you get the good outcomes for children and families. We've had too long a time in Ireland of money being given, if you like, rather carelessly at times, without examining the provision of service, the outcome, and doing the very best for children and families based on research. We are now, I would say, evidence-rich in relation to what needs to happen in Ireland. And that's very important, because before we were relying on international research. We now have our own research, increasingly, about what's happening to Irish children as young as 3, about what's happening to our teenagers. What is being presented here today on the positive systemic practice is precisely that. It's taking what has been done in Ireland over a long period, it's examining it from a research point of view and saying, yes, this is a model that can work, that does work, should be replicated, should be developed because it's doing the right thing for children, and we have the research to prove it. So I think it's going to be very interesting to hear about that from Professor Alan Carr. He and some of the staff from Crosscare were telling me earlier on that many years ago, a similar model was presented by some Americans who were in Ireland. And they were saying, you know, this model is really effective, it can work. And when it was presented in Ireland, a number of the people who'd been involved with Crosscare said, well, that's what we're doing. But they hadn't the research that showed that it worked. You have that research now, you've developed it over the years, you've developed the model, and that's what you're going to be discussing, as I say, here today. I'm delighted to have the opportunity to say a little bit about some of the changes which are happening in relation to support services for children and family at present. As you know, last year I published the Child Death Report, very sobering report, an analysis of 196 vulnerable young people, mostly teenagers, who died. They were known to the care services, had had some involvement. They weren't all in care, a small proportion were in care, many were in aftercare, many were living with their families, but they died. They died as a result of overdoses, they died as a result of accidents, both car accidents and other types of accidents. But at the end of the day, these were young people who had been known to the care services. When you analyse that report, one of the things that jumps out from it, in many of the cases, were the number of agencies who were involved with those young people. Many of the young people had about 14 agencies who were known to them, who had worked with them in a whole variety of ways, from the education welfare system to mental health services, to child and family protection services, to counselling, a whole range of interventions over a number of years. When the authors examined the interventions, one of the points they came up with, which I think is very interesting in terms of your discussions here today, was that the risk assessments that were done could have been stronger between the agencies, that perhaps a lead agency should have been appointed, but there could have been ongoing input from other agencies. Now, I know that all of you in this room are very familiar with interagency work, but I could never say often enough that interagency work, people on the front line getting support for more specialist services, can never be done enough. We can never share enough information. And in the new Children First legislation and in the new bill which I'm bringing to the Dáil this week, the Child and Family Agency Bill, we're going to be focusing on an obligation on professionals, on agencies, to work together more effectively. I recently hosted a roundtable that Amnesty International organised on mental health services and community services. And the message that jumped across the table from everyone there was that there was still a bit of a culture of referral on. You know, we've closed the case, it's being referred on to somebody else. I see people smiling in the audience. I think you know that that can happen. That shouldn't be happening. We definitely need the very best of engagement between specialist services, community services, counselling services, if we are to deliver in the way we would like to the young people who were reported upon in that discussion paper and that very disturbing report last year on the child death. So I think that's a message that we need to tease out and say, what are the barriers to interagency work that are still out there? What can we do as counsellors, as agencies working with the most vulnerable families? What are the next steps we need to take in terms of interagency work to do the best for some of those children, for example, those young people who are increasingly being referred to Oberstown? We now have, we've taken 16-year-olds out of St. Patrick's. We're going to be taking the 17-year-olds out. But what's happening? We're getting more referrals from the courts for detention, which should be a last resort. So how are we going to intervene in a way that isn't about detention for those very complex young people who at present are being referred to Oberstown? So we need to keep the numbers in detention down. That's going to be done by very multi-skilled work between committed professionals such as yourselves. So that's an area of big challenge. I mentioned the Child and Family Agency. That is the most radical reform we're involved in as a government. It's 4,000 staff. It's a budget of 600 million. We're taking these services out from the HSE. We're establishing a standalone agency. Why are we doing that? It's not for the sake of doing it. It's so that we can have a better focus on children and families and the services which they're getting at present. So we can have an umbrella over those services where people can work more effectively together. I want to assure you that it is not going to be simply about child protection. It will be about child protection in the broadest sense, but family support, teen counselling, support to individuals is critical if we are to deal with the numbers of referrals to the child protection services and if we are to stop young people coming into care, which is what we want to do. We have a certain number of young people in care in this country. I want to say to you, it's not disproportionate to the population by any means. But I was delighted to hear earlier about the amount of work that many involved with cross-care and teen counselling are doing with young people who've either been in care, coming out of care, or in foster care. I think that group, again, they are part of that percentage, that 15 to 19% percentage of our young people who need most attention from all of the services. And family support is going to be a critical part of the new agency because we obviously have to focus on prevention, not just on those crisis cases that are coming in the door of the child services. But equally, the child services have to have the preventative services available to them so not everybody gets referred under the heading of child abuse and neglect, and they get the appropriate service they need when they come in the front door. So that's why we're establishing the new Child and Family Agency. And we are moving, and Gordon Jays is moving to a situation where we have a common front door, if you like, in relation to the cases that come in, proper risk assessment, referral to appropriate services, and shared caseworking. That's what I've been talking about this morning. I'm also working on the Children First legislation. I think it's the right thing to do. Just last week, I met one of the international experts on mandatory reporting, Professor Matthews from Australia. You often hear the Australian cases quoted. In Australia, every state has mandatory reporting now. Every single state. It's a question of how you do it. It's the right thing to do. If a child is being abused, there should be a referral. But what is important are the thresholds in relation to the referral and training. Training is extremely important. And we do have to find budgets to support training, whether it's with cross-care and teen counselling or whether it's in relation to mandatory reporting. And that's, again, why I'm delighted to see so many people here today, so many wanting to come, to invest in your own professional development, to have the opportunity to hear about best practice and to take away those lessons and make sure that they're heard around the country. I'd conclude by saying we have a very difficult budget coming up. I want to ensure that the kind of work that you're speaking about here today, the kind of work that's been done for children and families around this country, that people know about it. I would say to you, don't be shy about talking about the work that you're doing. I'm converted, but there is a message out there for the community at large about the importance of this work that needs to be given. You see what a great job the farmers do. We've got to make sure that the work that you're doing, that people know as much about that as they know about the needs of the farming community. So well done. I see the work that's going on in my own area here in Clondalk, and I represent this area in Lucan, across Dublin. I see it all over the country. It's a great privilege to be Minister for Children and Youth Affairs at this time. It is a challenging time, but it is a time of great opportunity for all of us to do the very best for children and young people in this country. And thank you again for the contribution of cross-care, teen counselling, and all of you for the work that you do. Thank you very much indeed.